Welcome back to Tip TV Health. Let's talk to Dr Charlie from Harley, a man who's got more letters after his name than in his name. Right, let's kick off. I saw this was a really sad story about a town planner who's in the Priory, and I believe that he committed suicide.
That's right. Apparently he hanged himself, and there's presumably going to be some sort of inquiry as to how that really unfortunate event happened. So what's clear is when people have a certain level of depression, they're going to need monitoring and they're going to need one-to-one care because that person, until the therapy kicks in, is at risk of committing suicide. So we don't expect it to happen in the institutions that they're put in. Obviously, if they're outside, they might throw themselves under a bridge or throw themselves in front of a train. And that's why the Samaritans, a charity, is actually putting notices up by train stations and by bridges, because this is where men usually commit suicide.
Right.
Do you know the story of Matt Haig?
No, I don't.
Well, Matt Haig, very interesting guy. He was about to throw himself off a bridge in London, and one person's intervention stopped him. Someone talked to him, and that was more than 7 years ago. And Matt and some others have set up a charity called CALM, C-A-L-M, and it's to try and stop the levels of suicide in young men. And Matt's written a book. I believe it's called something like Reasons That Life Is Worth Living. So that's 7 or 8 years after that event.
Okay, well, that's obviously a book that people should consider if they're in that state of mind. So is the Samaritans the first stop, the last stop?
Yeah, it's a really good question. I think it's one of the stops, and you know, if you say it's the last stop, it might be the last stop before the end.
Yeah.
So I think the way people should look at it is if they think they've got a problem, call early, seek support early, and there's no shame in saying, look, I'm feeling a bit down, I'm not feeling well. The symptoms might be a low, flat mood, might be emotional tendency to cry, or just feel overwhelmed by life, waking up early in the morning, recurrent thoughts, negative thoughts, low feelings of self-worth. So all of those, seek help early. If you find that your GP is not doing what you think they should do, then nowadays you can refer yourself to a primary care mental health team. So you can actually do that yourself.
Right, okay, another good tip.